Methylene blue. What are some of the potential benefits? It's being researched for cancer fighting because it induces cancer cell death and inhibits tumor growth. Two, it helps the brain because it helps to increase oxygen delivery. So people who use it say they have better mood, focus, concentration, less brain fog. It also helps in your brain to increase your neurotransmitters like serotonin, dopamine, and norepinephrine. So people feel less anxious, less depressed, but you have to be careful. If you're taking other antidepressants that also increase serotonin, taking this together could cause something called serotonin syndrome with its own potential side effects. So don't take it if you're taking any antidepressants. Three, a lot of antimicrobial benefits. It was one of the first ones used before we had penicillin for the first 40, 50 years. It has potential for malaria, Lyme disease, bacteria, funguses, other parasites. It was even used during COVID, a lot of studies with that.
All right, so methylene blue is getting a lot of attention, especially after RFK, was shown putting some in the water. So are the claims being made for it true? Well, to some extent. I mean, methylene blue is a drug. It is being researched for a lot of its, activity. But just because it's like there is some evidence that it has some activity doesn't mean that it's useful or that you should be self-medicating with it. There isn't a lot of research looking at a lot of the effects that are being touted in this video, but let's go through them really quick. So probably the best evidenced one is the antimicrobial effects. It does have antimicrobial effects. Does that mean that you can treat yourself for a serious infection with it? I wouldn't do it. Again, you need to know the dose, the dosing schedule, how long you need to take it for. You need to make sure it has activity against whatever it is specifically you're treating. Just using it as an over-the-counter, all-purpose antimicrobial, not a good idea. I wouldn't recommend that. Going back to the claim about it improves blood flow to the brain, that has actually not been established. In fact, the first study I saw when I researched that question showed the opposite. There's actually a study which shows that methylene blue in humans and in mice reduces blood flow to the brain and reduces oxygen consumption. It has the opposite effect. Now, that is not necessarily the final word on that question, but we can't take for granted that it is doing that, nor can we take for granted that whatever effect it's having on blood flow or oxygenation, that it's a good thing, that it's helpful in everybody, including the healthy population. So one thing you always have to distinguish with these kind of things is, well, is it helping you if you're healthy at baseline, or only if you have a certain disease state or a certain physical condition? These are all very important questions that need to be answered before you could know how to use this therapeutically or clinically. Again, just taking it because it's going to non-specifically make anybody healthier is nonsense. It's not the way you should be using drugs, right? In fact, also, there is research showing that if you take too much methylene blue, it can actually cause encephalopathy. That's the brain not functioning, right? It could actually cause harm to the brain. It's a drug. It's not automatically benign just because it's natural. It's not even natural. It doesn't even make any sense. And then the cancer fighting capability. So it really only has two, I think, evidence-based uses in cancer treatment. One is to help, because it is a dye, right? It's to help identify, for example, lymph nodes that need to be removed because they might have cancer cells in them. So it helps to locate tissue that might need to be removed. It also can be used for different types of phototherapy. So essentially, you give it to you either give it to the patient or inject it in the tissue. You get it in the cancer tissue, then you use that to you use light to activate it, which then kills the cells, right? So you have to use it as part of a treatment. Just the methylene blue itself isn't necessarily having any benefit, or it's used to sort of guide either surgical removal or removing lymph nodes for cancer. So it is being used in those two sort of limited senses. It's not just an anti-cancer drug, right? Anti-cancer drugs are always very tricky. We take them in a carefully calibrated dose that is high enough that it has anti-cancer activity, right? It's killing or preventing the cancer cells from replicating or reproducing, but is not having more of a negative effect, a toxic effect on the body than the patient can tolerate. It's all about risk versus benefit. Where is that sweet spot of dose? Again, I certainly don't recommend dosing yourself, like self-treating with an anti-cancer treatment without knowing its activity against the specific cancer, or what dose to take, or for how long, and all the other things that you have to know about, such as drug-drug interactions, et cetera. So, going from some basic science or preliminary clinical science to making specific recommendations for use is really problematic. That historically does not work out well. Most things that look promising, most drugs that look promising at this early stage of research, do not pan out. Like less than 1% actually will work out as a useful therapeutic. Basically, it's wait for the research and do it under the guidance of a physician. It's a drug with side effects, with drug-drug interactions, with toxicity, and you have to know exactly when and how to use it properly. But just using it as like a supplement to self-medicate really is not good practice at this time, and I don't recommend it.
But can you lick it?
But can you lick it? You can if you want your tongue to be blue.
Technically, yeah, that's
You
true.
can lick it.
Yeah.
Get a
There you
blue
go.
tongue.
Blue tongue.
Then your pee turns blue.